Welcome to our final breakout session of ILOC this afternoon, although don't forget, we do still have an evening presentation. This session is all about saying yes to better health and about partnerships that can become a reality for your library and the Iowa Department of Public Health, the IDPH. And I bet you have to stumble over that every time you answer the phone, right? Our presenters today, we have three of them because they're going to be sharing three different ideas that can all be implemented in a library. And our presenters are Hailey Boudreau, Grossman, and Laurene Hendricks. And Laurene is going to begin, and her topic will deal with diabetes collaboration. So Laurene, I'm going to hand it off to you.
Thank you. Good afternoon. My name is Laurene Hendricks, and I am the Diabetes Management Coordinator at the Iowa Department of Public Health. My location is in Des Moines. I'm really glad to be here with you today with my IDPH colleagues. I'll be sharing about a unique collaboration. Please put any questions or comments that you may have in the chat, and they can be addressed at the end of the three presentations. I'm speaking in my capacity as Program Coordinator to provide information and some other resources. I'm not a healthcare professional. Funding from my position and work comes from a grant from the Centers for Disease Control and Prevention, and diabetes management is part of the grant that also supports prediabetes and cardiovascular interventions to reduce the impact of these conditions on Iowans. I'll just spend a few minutes on diabetes and education to give you some background to the collaboration. You may have diabetes or a family member or friend with it. Diabetes is a chronic health condition that affects how the body turns food into energy. Most of the food we eat is broken down into sugar, also called glucose, and released into the bloodstream. When blood sugar goes up, it signals the pancreas to release insulin. Insulin acts like a key to let blood sugar into the body's cells for use as energy. With diabetes, the body either doesn't make enough insulin or can't use the insulin it makes as well as it should. When there isn't enough insulin or cells stop responding to insulin, too much blood sugar stays in the bloodstream. Over time, that can cause serious health problems. There are three main types of diabetes. You're probably familiar with type 1, type 2, and gestational. More than 34 million people in the United States have diabetes. That includes 10.2% of Iowans, which is hundreds of thousands, unfortunately. Many, 1 in 5 Americans, do not know that they have it. 90 to 95% of diagnosed cases are type 2. Diabetes may be able to be managed with healthy eating, weight control, and being active, maintaining blood sugar, keeping healthcare appointments, and taking insulin, other injectables, or oral medications as directed. It's also important to keep blood cholesterol and pressure close to targets set by a physician and get necessary screening tests. Managing diabetes can help lower the risk of complications such as heart disease and stroke, kidney disease, nerve damage, foot problems, hearing and vision loss, and gum disease. Well, you've heard that there's a lot of things that you need to know when it comes to diabetes. Education that I mentioned on the prior slide is an evidence-based way to help manage diabetes. I'm talking about Diabetes Self-Management Education and Support, DSMES. DSMES is also known by DSMT, by Medicare, and it is a comprehensive evidence-based self-management education. People with diabetes learn to deal with the disease on a day-to-day basis, to live a healthy life, and to avoid or delay complications. Diabetes self-management education is generally taught by dietitians, nurses, and pharmacists, and programs are located across the state, and DSMES requires physician referral. DSMES, Diabetes Self-Management Education and Support, can help people with diabetes make better decisions about their health in coordination with their healthcare team, improve blood sugar control, blood pressure and cholesterol, and learn critical self-help skills. Well, the COVID-19 public health emergency complicated DSMES programs connecting with diabetes patients. Programs were challenged with program delivery, and people with diabetes faced virus exposure concerns, unfamiliarity with technology, and the issue of time and distance, travel time, that is. Patients in rural areas often had to travel long distances to in-person diabetes education. That keeps some patients from receiving critical information about managing diabetes. Fortunately, rules regarding program delivery modes, staffing, and billing were relaxed during the public health emergency so that education could be delivered in alternative ways. CMS, as well as other payers, afforded flexibilities related to diabetes self-management education program delivery. The Centers for Disease Control and Prevention offered flexibility to state diabetes programs in the last fiscal year by approving the use of funds for supplies and services to support program delivery via telehealth. The IDPH entered into a service agreement with Burgess Health Center in Ottawa and 6 other facilities in the state to procure supplies to enhance telehealth delivery. Through the agreement, Burgess Health Center, DSMES program in Ottawa, purchased a laptop, iPad and keypad, Bluetooth speaker, and USB cables and docking stations for meter downloads. The agreement entered into also provided support to conduct education to providers and staff on the benefits of diabetes self-management education, delivery modes, and the patient referral process to programs. Well, patients typically have to drive 40 minutes or more one way from the Dunlap area to come to the Burgess Health Center main campus in Ottawa. This can keep patients from attending diabetes education, an important resource for people with diabetes. A partnership built with the Dunlap Public Library and Burgess's Dunlap Clinic allowed the program to add new diabetes services to telehealth, by telehealth in the library for patients with limited access due to their rural residence and technology available to them. While no patients have yet been seen by the library, the collaboration continues to be promoted as a community resource. The partnership provides technical support and access to telehealth services to referred patients with limited familiarity and access to technology. The ability for providers to download meter, aids, and treatment plans, and this information can easily be shared with diabetes educators prior to the visit. Patients will be able to have a better understanding of their diabetes and receive the ongoing support they need. Working with the library provides additional hours when patients can make appointments, a neutral location for patients who need education but are not currently seen at the clinic. Having the iPad at the library can help expose patients to the library resources available for diabetes and other health conditions. As you've heard, information skills and resources are vital for people with diabetes. The Dunlap Public Library has some events in the spring, and the Burgess Health Center Diabetes Program plans to be there to support and promote telehealth visits. The librarian and the board are very supportive of this new partnership and service. There are some billing, logistical, and technology issues that have presented since the partnership was established, but Burgess Health Centers continue to promote this opportunity and looks forward to serving patients in Dunlap through telehealth and the Dunlap Public Library. Resulting from provider education activity, the Burgess Health Center DSMES program documented an increase in referrals to diabetes education services from several local clinics. A new partnership was developed between the DSMES program, the Burgess Dunlap Clinic, and local providers, and the Dunlap Public Library. Telehealth tools allowed Burgess to expand its diabetes and education services and increase access for referred patients through the Dunlap Library. So what could my library do? Well, there are several ways that you could, as a library, collaborate with local diabetes educators and providers. You just need to get to know them. You could host DSMES education, as has been shared, or open your doors to informational sessions for the public, promoting community wellness. You could obtain education materials and display them, and distribute them, perhaps with diabetes books from your library collection. Upcoming observances are Diabetes Alert Day, March 22, and Diabetes Month, which is November. Here's a list of resources online that could be useful to you in your understanding of diabetes, diabetes management, and self-management education. In addition, pharmaceutical companies have programs to help people get access to insulin and medication at lower cost, and those can be explored by visiting the company websites. You could assist your patrons, be a great resource to them with library and internet resources, library and internet searches for credible information and resources. Well, here's my contact information. Please be in touch if you have any questions. Contact me if I can assist you in connecting with a DSMES program in your area or for education materials to distribute at their library, such as the tip card on the slide. I have many resources like cards, posters, and brochures. The public health emergency wasn't all bad. It created opportunity for innovation in program delivery and community partnerships, which is all very exciting. Thank you very much.
Thank you, Laurene. And now one of your colleagues, I think, Allie, are you next?
Yes.
All right. And Laurene, I like your positive attitude about seeing all the partnerships that became possibilities during what was an otherwise dreadful time. All right, Allie, better choices, Absolutely. Better health.
Yeah, thank you. Thank you all for having me here today. My name is Allie Grossman. I am a registered dietitian working as a referral-based intervention coordinator for the Iowa Department of Public Health. I work closely with Laurene on diabetes prevention and management and heart disease and stroke efforts. Another thing I do, I am the program coordinator for a program called Better Choices, Better Health, which I'm here to talk to you about today. This program is Iowa's chronic disease self-management program. It's an evidence-based program that the Iowa Department of Public Health holds an umbrella license for from the Self-Management Resource Center to work with partners across our state to administer the program to Iowans. It's a 6-week workshop that takes place for 2.5 hours a week, and it's led by 2 trained peer leaders. Workshops take place in a variety of community settings, clinics, and can also take place virtually. So some of the conditions that fall under this program are really any chronic condition, anything from diabetes to heart disease to asthma, emphysema, trouble sleeping. All different chronic conditions can fall under this. This program is also great for caregivers of people with chronic conditions. We know that people who are caring with people with multiple conditions often have a lot of difficulty themselves dealing with those. So this program really can capture a large number of Iowans. Community settings, we have hospitals and clinics that partake in this, a variety of community settings such as churches or senior centers. This program is really great in the sense that it can be offered anywhere. So a little bit about what takes place in the participant workshops. Workshops really focus on action planning and problem solving. It provides support to build the confidence and the ability for the participants taking this workshop to manage their chronic conditions and to live active and fulfilling lives. Content includes techniques to deal with problems such as fatigue, pain, difficult emotions, physical activity, appropriate use of medications, communicating effectively, and that's communicating with healthcare providers, family, friends, and also healthy eating. A little bit about the history of this program. So Better Choices, Better Health was developed at Stanford University in the early 1990s, and it was part of numerous rigorous research studies. The studies found that the chronic disease self-management program increased healthful behaviors for participants, improved overall health status, and participants had less healthcare utilization. So this program, the 6-week workshop for participants really showed effectiveness and cost saving, and that has been proven through many studies beyond what took place in the early 90s. The program continues to be updated on a regular basis as well to stay on those are people on through the training to become an active peer leader in our state. We have 3 master trainers. So those are the ones who are responsible for conducting trainings for us each year. The Iowa Department of Public Health currently holds about 1 to 2 trainings a year to train new peer leaders or people interested in offering workshops in their community. So we have 3 master trainers that help do that. And we currently have 11 organizations offering the chronic disease self-management program. So like I said before, hospital systems, clinics, we offer it at the state health department. We have local health departments, churches, and different community organizations. This number is down a little bit currently because a lot of our partners have had to divert their work duties to the COVID-19 pandemic and pandemic response. So we have a lot of room for improvement, which is why we're here today. Always looking for new partners. So a little bit about what the Iowa Department of Public Health provides as far as support and technical assistance. So we have some grant funding through the PHHS block grant to help support workshop materials. Participants, when they take the workshop, they get a book called Living an Active Life for Chronic Living. Living an Active Life with Chronic Conditions. Participants receive that book. They also receive a CD or an MP3 of different relaxation techniques, some guided imagery, and different tools that are used and that participants learn in the workshops. We also provide peer leader training support and marketing support as well. So for a lot of our partners that administer this program under our license throughout the state, we will put on like targeted Facebook advertisements to help advertise their workshops. And we do a variety of other marketing to help people fill workshops once they have them planned. IDPH facilitates Iowa Network bi-monthly calls. And this is a time where peer leaders throughout the state can gather virtually. We have a variety of different discussion points at each call. It's not required that people join, but it's just a nice avenue to talk with other peer leaders in the state about successes and challenges, things that work, things that don't. So it's just a good networking time. We provide continued licensure from the Self-Management Resource Center through our umbrella license. And then also peer leader training and materials. So we are able to provide peer leader training free of cost to individuals, which is really exciting to help alleviate some of the financial burden. So the requirements to become a peer leader, peer leaders do not have to have any kind of medical background. In fact, it's been shown the efficacy of the program is actually better when it's somebody, just a peer or somebody else living with a chronic condition. So it's really recommended to try to find community members or volunteers that want to be helpful to their community and connect with others. That being said, we do have a lot of medical professionals that do become peer leaders to help offer this program in their organization. A peer leader must successfully complete a peer leader training, which is 13 virtual sessions that are 2.5 hours a piece that span over 7 weeks. Prior to COVID, we used to meet in person for 40 hours for 1 week in person. However, we were granted the ability to start offering that training virtually due to the pandemic response, which has been really great because it's alleviated cost for people, alleviated travel time. It's just made it easier for our partners to get trained. You must conduct your first workshop within 1 year of completing the training. We always recommend doing that within 6 months of completing the training. And to remain an active peer leader, you must complete 1 workshop a year. So you must co-facilitate 1 workshop, 1 6-week workshop a year. And then we request that workshop data be submitted to the Iowa Department of Public Health so that we can properly track everything under our license. So there's a pre and post survey for participants. And then we just ask for the location and a few other details about the workshops. And then we track all of that so that you don't necessarily have to be responsible for tracking data. It's just getting that data to us. So a little bit more about the peer leader training or upcoming peer leader trainings. Like I said, the Iowa Department of Public Health sponsors and conducts 2 free trainings, 1 to 2 each year. There are also ways to get trained through our licensing organization virtually as well. So if you're on our website and you're noticing that you don't see a training coming up, you can always email me. I'd be happy to put you on a list. That helps me track and helps me know how many trainings I need to plan. Lately, there's been a ton of interest, which is great. So like I said, the training's free and virtual, 13 sessions that take place over 7 weeks. There is an application that gets submitted to me via email. So a little bit about our COVID response. Workshops moved virtually for the first time in 2020 because of the pandemic. Prior to that, we were only offering workshops in person. This has been a huge success. We've been able to reach more people offering it virtually. However, some people do still prefer in person. So when you get trained as a peer leader, you do have the option to offer these programs virtually or in person. And then I discussed the Iowa network calls. These were developed because of the COVID-19 response, because so much was changing and there were so many questions about switching to a virtual platform or for the organizations that started adopting that way. So we just continued them because they were such a success. We continue to discuss any updated guidance, challenges, successes, or any other issues that might arise during workshops or success stories that we'd like to share. So what can my library do? The great thing about this program is it's a low-cost program. Really all it requires with the support that the Iowa Department of Public Health is able to provide is people going through the training and offering their time for conducting the workshops in your communities. So you can start offering a Better Choices, Better workshop at your library. If you can identify 2 leaders to co-facilitate the workshops with, you submit a peer leader application to me and enroll and complete the peer leader training, you are able to offer workshops in your community. So that's kind of the best and easiest way to start offering Better Choices, Better Health workshops and improving the health and the lives of people with chronic conditions or people caring for people with chronic conditions in your community. We are able to provide peer leader training information, peer leader training free of cost, and participant and leader materials. We just need your time to administer the workshops. So once you complete a peer leader training, we do provide you with participant materials and you can always reach out to us for more. Another way that you can help your community is you can help to promote workshops that are currently taking place in your community. So by emailing me, I can add you to an email list where you'll receive communication from me about when registration is open. You can also go to our website, and I apologize, that is listed very lightly there. I can put our website in the chat box as well. But I keep our website up to date. So if you go to the Iowa Department of Public Health and search Better Choices, Better Health on the search bar, you will see all of our information. So I post when we have workshops that are open for people to register for. And then I also post updated information on any peer leader trainings that are coming up. So we just filled our next peer leader training up, but we are already on to planning another one. So stay tuned. And you can always email me with any questions if you want to learn more about the program. You can email me. I'd be happy to chat with anybody about the requirements or what it would take for your library to successfully administer or just help promote better choices, better health in your community.
All right, wonderful, Allie. Thank you. We had quite a few questions come in, people expressing interest, so I will share those questions after we hear from Hailey. I did put the link to the Better Choices, Better Health information from your IDPH website. I put that in the chat. So Hailey, you're talking about fresh conversations. I believe this has to do with maybe food choices.
Yeah, thanks for having me. I'm Hailey Boudreau with Iowa Department of Public Health. I manage Fresh Conversations. This is housed in the Bureau of Nutrition and Physical Activity. You might recognize some of our other programs here. I believe the libraries were presented with 5210. We also do Pick a Better Snack, which you might recognize if you are in a school library. And then we also house Iowa WIC as well. Fresh Conversations is a SNAP Ed program funded by the USDA. SNAP stands for Supplemental Nutrition Assistance Program, which is previously known as Iowa Food Assistance. SNAP Ed is the education portion of this. Specifically, SNAP Ed programs focus on disease prevention, such as obesity through, disease prevention, such as obesity, through evidence-based education, public health approaches to achieve sustainable behavior change, and the SNAP Ed target audience. Fresh Conversations is an evidence-based program. It's research tested, and we are in the SNAP Ed toolkit as well. So the program goals for Fresh Conversations is to improve healthy eating and nutritional risk. And this is all within adult 60 plus, so that's our target audience. And then also to deliver age-appropriate, interactive, science-based educational materials and experiences that are relevant to healthy aging. This is a free nutrition and physical activity education program. And the program aims to improve healthy eating and physical activity to encourage healthy eating and independence. We do target adults 60 plus, specifically trying to reach low-income SNAP eligible participants, but all adults 60 plus are welcome. Fresh Conversations meetings are 30 to 45 minutes long and are led by a trained facilitator. Facilitators, similar to Better Choices, Better Health, do not need to be health or nutrition professionals and are often better facilitators as well if they're peers or if they are, a community leader as well. We at IDPH offer training and assistance to all facilitators. And at the meeting, facilitators follow a guide that discusses key points of the Fresh Conversations newsletter that participants receive. And we provide information on that guide as well. This is an example of the guide. It's probably really small on your screen, so I apologize. But these are available on our website, so you can go to our website and explore that as well. Facilitators use the guide with behavioral objectives, key nutrition messages, facilitation dialogue, activities, recipe tasting options to lead Fresh Conversations meetings. Each meeting is meant to be an interactive group discussion. Fresh Conversations serves as an opportunity for participants to interact with peers around important health topics, but also increase social interaction. We definitely know during COVID, there's been a lot of people cooped up at home. And so we really are hoping to alleviate some of that social isolation with Fresh Conversations as well. This is an example of our newsletter that we have. I have a couple slides of them. Again, I apologize, it's probably small on your screen, but these are available on our website as well. At Fresh Conversations meetings, all participants receive a 4-page newsletter. All topics are fresh or recent and relevant topics for aging. Newsletters are written based on nutrition and physical activity evidence-based research. In each newsletter are 3 to 5 different articles. Also included in newsletters are diagrams, pictures, callouts, graphs, and cutouts. Over the years, we've had different topics covered, and those are food labels, as you can see, it's pictured here, processed foods, heart health, sleep, oral health, carbohydrates, diabetes, lots of different topics. A registered dietitian actually writes the newsletters. A team of other dietitians and health professionals review and provide edits to the newsletter. And then another big piece of the meeting is an opportunity for participants to write a goal or small steps to reach a larger goal. And they do that in each meeting. And there's an arrow here that is showing you where they do that. At each meeting, participants are invited to taste a recipe that's often featured in the newsletter. Included in each newsletter also are puzzles or games that participants do to help reinforce educational content. So we do also offer the meetings over Zoom and Facebook Live in addition to in-person. In person, these meetings often take place at either congregate meal sites, low-income housing, community spaces like libraries, churches, parks and rec facilities, community centers, kind of wherever they can find a space. We currently have programming in 18 counties. We have a great partnership with 2 libraries in Polk County, the Northside Library here in Des Moines, and then the Urbandale Library. We would love to expand to more libraries as well. So in these counties, and then also we're looking to involving other counties outside of these as well. What can your library do? If you are interested in fresh conversations, we're always looking to host sites or, to either have a host site or a host site and facilitation. And just a reminder, we do offer training and technical assistance for all facilitators as well. This is my information if you want to contact me. And I can put all of our information in there in a second. And then we do have some other IDPH programs that we wanted to share information about that couldn't be here, that are willing to provide information to all libraries. The first is the Alzheimer's disease and related dementias program. And so the contact information is on here, and you all will get a copy of the slides as well. I know they provide bookmarks to libraries. And then we also have the Care for Yourself program, which includes cancer screening. They have quite a bit of information that is available for free for libraries. All this information is available for free. And then we also have quite a few brain health resources. So IDPH's Brain Injury Services program, and then the Healthy Habit All-Stars program as well. All right, and I'll flash up our emails one more time.
Thank you to Laurene and Allie and Hailey. And I do have some questions that came through. Laurene, you mentioned that about the diabetes self-management providers. And I know you shared a list of some resources that included information about diabetes, but is there a list of who those providers are that can provide that self-management information that you were talking about?
There's a list of programs on one of those resources that were on my resource slide.
Okay.
And it directs you to the website, and there's a list. Those change quite frequently as far as sites. I don't have individual names, but if you saw one in your community or in your area that you'd like to connect to, I would be happy to make that connection.
All right. And then Allie, this one is about Better Choices, Better Health. Is your program limited to only those individuals who have chronic conditions? And this person asking the question says, this seems like a great program for those who want to be proactive with their health before they might get a chronic condition. So Allie, is this limited only to people with chronic conditions, or can anyone participate?
Yes, this program really is tailored to people with chronic conditions. However, that being said, and their caregivers. That being said, there are a lot of different conditions that fall under that umbrella. You know, I mentioned heart disease, arthritis, diabetes, depression, asthma, bronchitis, emphysema, any physical or mental health condition. So when we think about the number of people out there that are affected by one or more of any chronic condition, it really is targeted toward a large number of Iowans. But yes, the focus of the program, although I will say it definitely is beneficial for anybody, the focus of the program, the targeted audience, is people living with chronic conditions. So
it's a second full purpose of it may be as a support group for people with these symptoms, right? With these conditions. For sure.
Absolutely. Yeah. It's really a program that it's very participative program, or participants really work together to solve problems. And ultimately, really what people learn in the workshop is that no matter what challenge or chronic condition you have a lot of the same challenges that come with living with chronic conditions. Okay. Lack of sleep or, little motivation. So it's a very highly participative class.
Okay. And the training for the peer leaders, is that synchronous or asynchronous? Is it a live training that they have to be in a classroom, whether in person or online, at a designated time, or is it something they do on their own?
It is live, and it's very participative as well. So it's not a lecture class, it's a participative live class. How it's operated, we're currently doing them virtually, which seems to be working out great, but it's really operated where you learn about the program, and then the last half each week, you're acting as a participant and actually going through the motions of the program and the activities. So you do have to attend the virtual live sessions.
And someone is asking about those peer leaders. The question is, are there trained peer leaders who are willing to visit other communities, or is it intended to be somebody in the community that leads the training? So I guess, you say it's supposed to be peer led. I'm thinking you want people that maybe other community members might know, but are there people who are existing leaders that would be willing to go to another community and lead a workshop in a library?
So there is, you can definitely share peer leaders. If there's somebody trained near you, that's absolutely okay for somebody to come into your community and facilitate the classes. However, we just find it typically works best if you have your own peer leaders. You have a lot more control over your workshops.
And this is kind of a related question. Do the libraries need to find their own persons in their community to become a peer leader? Or if I tell you I'm from the such and such town library, can you tell me, is there somebody already going through the training? Maybe I just don't know, or is it my responsibility to find somebody in my community?
Ideally, you would find your own leaders if you were looking to implement the program in your library. However, if there are, you can always reach out to me. And if there are leaders already existing in your community and we can help facilitate that partnership, that would be awesome.
Okay. And just, can you clarify your Better Choices, Better Health? It is designed for adults or older adults, any adults, teens, kids?
Adults.
It is adults, yeah, but yeah. Any age adult, not the over 60, right. like Hailey's program.
Yeah, any age adult.
All right. And if a library is going to do these 6 weeks worth of workshops, what type of a setting do they need? Do they need to have a separate meeting room, or would it work to do it in an open space in the library? Do they have to have specific technology? What's the setup like for these workshops?
Yeah, great question. If you are offering it virtually, people would just have to have access to a web camera. If you're offering it in person, it is best to have a private room, because a lot of times these workshops do become really personal. People often share very personal facts related to their health conditions. So it would be best to do them in a private room in a library setting, or anywhere in your community, really, if there's a room in your community that you would like to facilitate them with.
Okay.
That would be ideal.
Hailey, this question is for you. Someone says the Fresh Conversations newsletters look great, and I have to agree. And this person wants to know, can the libraries just print off some of those newsletters and distribute them in the community, or are these specifically for the participants of the Fresh Conversations program?
Yeah, that's a really good question. So Fresh Conversations is meant to be a direct education a program. So although the newsletters are great and people do read them by themselves, kind of like Better Choices, Better Health, it is meant to be a program that people are participating in a group discussion. That's how we've received our evidence-based, research-tested kind of stamp. And so we do recommend that you hold a Fresh Conversations meeting. They are available online, so we don't have control over who is printing them off or who is reading them online, but they do get more information through the facilitation and then also with participating with peers about whatever the topic is at that time. So highly recommend doing a group setting instead.
I remember that Allie said her sessions, the Better Health, Better Choices, Better Health, those are 6-week sessions. I don't recall that you said, Hailey, about the Fresh Conversations. Is that a set time period?
No, you can go forever to Fresh Conversations. So we have one
a drop-in kind of event, right?
Yeah. So we have it year round, and it kind of depends. Right now, it's only offered in Iowa once a month, but we're looking into changing that potentially like weekly or bi-weekly. That's something that we're looking into exploring as well. But Fresh Conversations just kind of keeps on going. So we encourage people to come as often as they can. I think. Oops, sorry, go ahead.
No, you go ahead.
I was just going to say that we do see better outcomes as participants come more often. So usually once they reach 8 or 9 sessions, that's when we start seeing better outcomes.
So is the goal to basically get like a cohort where you have the same people maybe developing relationships as a group going through all of the classes and the education together then?
Yeah, that's a great goal as well. Oftentimes, these are held, like I said, at congregate meal sites or libraries or places that can link them to other services as well. We're talking about nutrition and physical activity topics, but then if we can, Better Choices, Better Health is also hosted at the same place, or if they can go across the street and get a free meal or, get energy assistance in the same kind of area. We're trying to hopefully encourage linking of services as well.
You mentioned that some of those programs in your Fresh Conversations, Hailey, that they have recipe tasting. So I have to ask, who does the cooking? Who provides the food? How does that work?
So, the facilitator does the cooking of the recipe ahead of time. Oftentimes, like we have contractors that implement the program and they do provide reimbursement for the recipes. So there is reimbursement offered for the recipe tasting as well. And we often use Spend Smart, Eat Smart recipes, if anybody's familiar with them, which is through Iowa State University Extension.
And can you say that name again?
Spend Smart, Eat Smart.
Spend Smart, Eat Smart. Okay. So we had quite a few participants in this session, which is great. And I think you've got wonderful ideas. So I think I've asked all the questions, but just one more. So a library thinks, I want to focus on better health aspects just broadly in my library for 2022. I'm fired up about this. What's the first step? What should they do? What direction should they go? Should they maybe pick a target age group to work with? Because it sounds like you have programs that cover the gamut from kids to teens to the adult programs you've mentioned today. What advice would you give to a library?
I think focusing on an age group is probably a good place to start. I mean, IDPH has tons of programs and free options for people. And so also, if you have like a community survey or if someone else has done like a needs assessment and, you figured out that your community has a higher rate of developing diabetes, maybe that's some information that you could collect and find what the needs are that way as well.
We have another question here. One of our librarians is wondering if you have a list of good book resources that might help complement the topics you've explored here today that the librarians could order and have in their collections.
I did mention doing some displays with particularly diabetes in the library. I was on the American Diabetes Association website recently, and they didn't have a lot of books, but at this time, but in the past, their books are very good, and of course, they are very sound and credible. And so American Diabetes Association books, which could include just taking care of your feet, taking care of your eyes. I have diabetes, this is my first year. What do I do in my first year? And they also have had a variety of cookbooks too. So those could be available to the American Diabetes Association, or maybe just from a local bookstore, from a Amazon or Walmart type of book availability. But I don't have a list, but I would go with American Diabetes Association books mainly. There's also another good resource called Taking Control of Your Diabetes, and they have had some books over the years. I think the book is actually the most recent iteration, so it's like the 4th edition or something, called Taking Control of Your Diabetes, and that's also a great resource for a library. So.
Allie, Hailey, any titles you would recommend?
I can add to that. The book that complements workshops is called Living a Healthy Life with Chronic Conditions. So this is the book that we use to complement the workshop. However, it's a great book for a variety of chronic conditions, and it really facilitates or teaches people how to become active self-managers of their health. So that's a great book. Also, if anybody's considering, I know I've already had a couple emails come in. If you're wanting to learn a little bit more about this program, I'd be happy to donate a copy to you if it's a program that you think you might utilize to kind of take a look at some of the information that we do in Better Choices, Better Health. But you can order that book through Ball Publishing, and it's called Living a Healthy Life with Chronic Conditions.
And Mary, I did put the title. I put the title in the chat, Mary, right above what Perfect. You asked. I put it in right away when you said it, Allie, and then Mary asked the question. All right. We have just a few minutes left. Any other questions? I have a feeling our presenters will be getting a lot of contact from librarians. Looks like great information. And librarians, those of you in attendance, if you don't think you're up to hosting a workshop or becoming a peer leader or finding a peer leader, at the very least, I think there were a lot of good links that were shared today and a lot of good information on the Iowa Department of Public Health's website. If you can use those as library guides, LibGuides, and post that information as pathfinders on your website, or maybe print out a bookmark that references some of these resources, I think those would be great ways to at least do a little bit of promotion and to make the information known to your public. And who knows, maybe you'll be able at some point in time in the near future to host a workshop or become a peer leader yourself. Samantha, I think you have some information. And thank you, Allie, Laurene, and Hailey. This was all very good information, very exciting, good opportunities for public libraries, I think, to partner with your organization.
Absolutely. Yes, I can say that. I've been talking with Hailey about doing a presentation on this topic for a long time. And so I'm glad that it worked out to do something. And I think we'll have more public health stuff coming up in the future as well. So thank you to Hailey and Allie and Laurene all for being with us today.